I am actually a colorectal surgeon. I work at Rutgers, New Jersey Medical School. I did my medical school training in New York, but I'm Boricua, Puerto Rican from Texas. So I'm a Latino surgeon, which is not as common. In my current roles, I am actually the clerkship director for the surgery clerkship. And then I do a bunch of different sort of like other like admin roles, but that's probably my largest one. Really means allowing us to have a voice and to feel supported and valued in what we bring to the table. You feel valued, you feel supported to be able to share your opinions. Sometimes there is a tendency to just bring us in, but then like what we're out loud to really contribute is doesn't feel quite as substantial as everyone else. I think it's really important for us women to stick together. And sometimes I think that AWS really helps foster that relationship between women surgeons and frankly the allyship that we require from male surgeons also. And I think by kind of like pushing the vision and encouraging people to be engaged and involved is really important because it sort of helps create that support system that we all need as we navigate various different cultures and hospital settings and departmental settings and chairs and things like that and responsibilities as women in surgery. Mentorship, inspiration. I think like what's important to me is as well as a belonging. I think what's important to me is that I want other surgeons or people who are considering the field of surgery or medicine to see me and see themselves and know that um, all of the trials and sort of tribulations and the things that the steps that I've taken to get to where I am today. But I belong here. And so it hasn't, my path has certainly not been a very sort of straight and narrow path, but I'm here, I belong here. I can make a difference. And I hope that just by sharing my experience, sharing the realities of what it's like to be a surgeon, that I can inspire people to pursue whatever path is, appropriate for them. So I think if what I think I want people to remember me by, I would say that, Dr. Alvarez was very inspiring. She was a great mentor. There are many, but if I had to choose, it probably one that I will share is frankly sometimes the interaction with my patients. And I have certainly been, so again, I'm Latina, I do speak Spanish, and and that's important in the patients that I care for, because most patients, even if they speak English, and when they know that I speak Spanish, they prefer to speak in Spanish. So it's really great because we have a great relationship, and it's kind of a nice way to sort of kind of connect, right? But yet, frankly, sometimes I've had patients who have asked for someone who's a bit older or a male surgeon, or sort of the implication that being a female or a Latina is like means that maybe perhaps and again, a younger appearing, um, it makes me not quite as experienced or not like have the know-how of what is really required for them, and if things go wrong, or will I really know what to do? And so that can be quite frustrating because, again, a lot of times I'm caring for patients who are with literally in my own community. And it's, you feel sometimes as you go along, like how many more years, like it's 2026. So don't we know better? But again, it's kind of part of that, old habits die hard. And so sometimes no, people actually still don't know better. And they kind of, again, look at me with a lot of suspicion around like the recommendations and what I'm saying. And so that can be frustrating, I think, and still challenging as a physician. Safe space, patience. It was frankly from a female transplant surgeon. She told me to always do things on my own time and to not allow my desires, my professional desires and work to sort of like dictate that. Just whenever you're ready to do something in your life, live your life and make those decisions based on what's best for you, and know that the professional career and the demands and all of that will all just appropriately adjust. the fact that I have this really unique skill set and that I'm able to help people. What I bring to the table matters and because I am valued.